Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Early onset neonatal disease. Early onset neonatal disease, as the name says, it occurs early. That is, it occurs in infants, that too within first week of birth. That is, it occurs mainly in neonates, that too in first week of birth. And it is mainly seen in the first 48 hours of life most commonly. Most commonly, it occurs in first 48 hours of life only. So, this early onset disease is mainly acquired by colonization of the during or before birth by the colonization of maternal genital tract. See, this streptococcal agalactia may be present in maternal genital tract. So if it is present in the maternal genital tract during birth, unknowingly the child might inhale or he might come in contact with this streptococcus agalactia, resulting in this early onset disease. The main risk factors of this early onset disease are prematurity and maternal factors, especially in prolonged labor or prematurity, are the risk factors of early onset disease. This early onset disease of streptococcal agalactiae mainly presents with neonatal sepsis. Here it presents most commonly with pneumonia, or it can present with respiratory distress syndrome. After respiratory distress syndrome, the infection may spread into the meninges, resulting in meningitis. So as a result, the child presents with respiratory distress, lethargy and hypotension.
thank you and thank you for watching.